yet another edition of Rising Kashmir Debates. As promised in the previous edition, we'll be discussing about the health-related concerns during the month of Ramadan. As we know that Ramadan is seen as a month that actually renews the body mechanism. But there are many who fear that the month of Ramadan will bring so much trouble, especially to those who are already having issues related to their health. That is why today Rising Kashmir debates Ramadan and health, because we are into the middle of Ramadan. And to discuss this, we have with us an esteemed panel of guests. Dr. Abdul Hamid Zargar, he's an endocrinologist, and we have with us Dr. Iqbal, he's a general physician. Thank you very much for joining us on this forum. Actually, we thought that we are in the middle of the Ramadan and people are complaining that we are in the middle of Ramadan and we have health-related issues. Each day, people are saying, and we read all across, even on the Facebook and all the networking sites, that they have issues that they cannot fast. But we know that Islamically, we cannot avoid fasting. Yes, there are extreme rules where we can. Dr. Saab, I'll just directly start with you. That I want to know that scientifically, what is the impact of fasting on the human body?
If you look in totality at human sickness and you look at the month of Ramadan, there are two types of disorders that need to be widely or broadly discriminated. One group of disorders is acute sicknesses, that come just middle of the road sickness, somebody getting a huge vomiting and diarrhea, somebody getting an infection, pneumonia, somebody getting a typhoid fever, somebody getting a road traffic accident. So those acute events, which are quite empty in number, they aren't small in number, they constitute a big component of the day-to-day sickness. Those decisions are invariably dictated by the seriousness of the situation and at what stage of convalescence that particular individual is. And the treating doctor at that given time is the best person to opine. Somebody being on an IV fluid, somebody being on drugs, that time we have to leave it to the decision of the treating clinician, that how best he thinks his patient would make the day. And by the time convalescence is over, then things come back to the norms, and whatever the basic underlying subtle religious component of Ramadan is, that needs to be carried through. But the major group of things or patients or disorders that probably you are basically alluding to are those individuals who are otherwise stable, running through their lives routinely, but have sicknesses for quite a while.
Right.
What we call non-communicable or sicknesses or lifestyle diseases.
Right.
Which are reasonably stable. One of the commonest would be, somebody having had a heart disease, myocardial infarction, heart attack, a stent or two put in, a surgery done, and on a dozen drugs at different times of the day, and now feeling reasonably comfortable. How do we behave with him? Vis-a-vis Ramadan. Second would be, somebody having a diabetes, which involves hordes of people. In India alone, 6.2 crore people, and you can see the number globally. And this is another group which needs, is a quite relatively stable group. Need definitive guidelines.
We'll definitely speak about diabetes, but what I want to ask is that what is the impact of fasting for a normal human body? As you're a doctor, scientifically.
You see, if you look at it, two important things do happen during the month of Ramadan. And a lot would depend on the duration of the fast.
Right.
So when you fast today, the morning starts at 4 o'clock till almost 7:45 in the evening.
Right.
And then if the Ramadan is in the middle of the winter and you start fasting at about 6:30 and you open the fast at 5:30, a lot would depend on that duration. So two things would happen. One, whenever we eat anything, this basically is we call it nutrient availability to the body. It's for maintenance of the body, for the running of the body, you need definitive nutrients, whatever they are. So they need in a structured and timely fashion.
Right.
Now here that timely fashion is gone. You have a huge gap.
Right.
So you have a morning breakfast at whatever time, you have a little bit of a lunch and you have something snack in the afternoon, you have a dinner later in the night, and some people have an early supper with something at the bedtime. That latitude is gone. So it comes down to whatever you have to eat over a relatively brief period of time.
Exactly.
And you cannot eat throughout the night. So That's one area that nutrients are made available, but they are in a brief period of time. So you are overdoing it at a time and underdoing it rest of the time.
Right.
Second important thing is that fluids are an important component of our body. And particularly when Ramadan is in the middle of a hot summer.
Right.
And you have a huge 14, 16 hours fast to keep. Fluid deprivation would be something that you'll be looking at when you're making a decision whether one of your patients is going to fast or not,
Okay.
whether it's going to be deleterious on his health or not.
All right.
So this concerning the chronic sickness that I alluded to. Third thing would be, essentiality of treatment that he needs for life-saving medicines. If somebody needs a life-saving medicine after every 6 hours, after every 4 hours, or can it be done leisurely after every 12 hours?
Right.
So now those things do help in ultimately making a decision that will be appropriate for the person who is in front of us.
Right.
Because the decision about a particular individual has to be customized to the
Exactly.
sickness and requirements of that particular individual.
But Dr. Iqbal, overall, when we look to a normal human being who's not sick, who is relatively healthy, but when we look that the nutrient level comes down, the fluid level comes down, is it healthy, like fasting for like 16, 17 hours? What kind of an impact does it have on the body?
Well, lately I would say that Muslim scientists, especially those related to the medical sciences, have worked on the effects of Ramadan throughout the world these days, and it has been noted that Ramadan does slow down our metabolism. And the rate at which our metabolism goes is called the basal metabolic rate,
Right.
BMR. So there is a fair conclusion that this metabolic rate gets slowed down, and that helps us to conserve energy.
Right.
And once we have the energy conserved up, it helps in halting or reversing the body excessive wear and tear. So that's in one area where Ramadan has been found to be extremely useful for the human body. It's extremely useful also for those who want to reduce their weight but cannot otherwise do it. They could they could make use of this month to reduce their weight. So that's another area where it will be helpful. And in case of hypertension, that's high blood pressure, if it's mild or moderate, it has been found to have a very healthy effect if those patients do fast, especially if they are overweight.
Okay.
But then in severe hypertension, that means severe blood pressure, especially if it's associated with other disorders, it won't be healthy to ask that patient.
Okay, so we talked about the nutrients and the fluid level in the body. When we talk of this, we have immediately in mind that diabetes. There are people who are diabetic in Kashmir, and there are so many people. There's a huge population suffering from diabetes, and their concern is that will they be able to fast for such a longer duration? So what is that such people who are suffering from diabetes should do?
If you look at diabetes, when we label an individual as a diabetic, there are hardly two diabetics who are similar. It's a huge spectrum of disorders, and a person can be at any level of the spectrum. If at any given time we look at the number of patients who have diabetes, there will be a huge group of patients who fundamentally would be controlled on diet moderation. As my friend very rightly said, obesity is a huge issue. It's a huge issue. And one of the first things it does is leads to glucose intolerance, leads to hypertension, leads to cholesterol increase. Just reducing that is the treatment. And probably at any given time, if diabetes is diagnosed in time, almost 1/4 of people would be reasonably controlled, if not for all times to come, but for quite few years on diet alone. So this segment has no problem in fasting. In fact, it's be terribly helpful. There is a group of people who invariably are on a drug which is known as metformin. This is a first-line drug we give. All those people who are on metformin can reasonably fast because metformin does not cause hypoglycemia. In what way? We give this drug even to people who are not diabetic for different indications. Realizing that, when the blood sugar comes back to the normal, its effect sort of switches off. So we are reasonably comfortable with that. Then there are certain strategies where, there is a more intensification of the treatment. So long as oral therapy is concerned, means so long as you're taking the medical drugs.
Right.
One of the commonest things that most of the times we do, normally, a big chunk of the drug is given in the morning and slightly lesser drug is given in the night. No. People who are on 2 doses of insulin invariably can fast. But the only difference is, as I said earlier on vis-a-vis drugs, the morning dose is a bigger one than the evening dose. The morning dose gets shifted to the evening. The evening dose you truncate by half.
Okay. So, Dr. Iqbal, I just wanted to ask you that is it that the patients with diabetes who usually get injected, can they go for injections even when they're fasting, or it's just their fast gets dissolved when they go for injections?
As my friend Dr. Zargar rightly said, that with adjustment of dosage, even insulin-dependent diabetic mellitus, we call it IDDM, in medical terminology, insulin-dependent diabetics can fast, provided the dosage is properly adjusted. And nobody is better, nobody can advise you better than one of the most eminent endocrinologists and diabetologists we have in this subcontinent. In fact, he has a worldwide fame in diabetes, and he is the right person to ask everything you want to know about diabetes and fasting.
I have a question that usually people in Kashmir visit doctors when they're sick, when they get to know or have a little bit of idea that their body is not well. But otherwise, do patients come to you for a general checkup to ask you what is good to eat in Ramadan and what is not? What can they eat so that they'll have a healthy body and a good mechanism? Or what should they avoid? That is my question.
There's a big segment of people who just walk into Ramadan without consulting their doctors. And either they walk out of Ramadan comfortably, then whatever the fallout, the doctor has to look after it.
Exactly.
And getting into the middle of a mess somewhere in the middle of Ramadan and walking into the clinic.
Okay.
That's not the right thing to. I'll tell you, we have today data available. I was just last month giving a talk in Bombay to the Indian endocrinologists how to handle Ramadan in diabetics. So I was telling them, one basic fundamental rule, it's very difficult to sanitize 6.2 crore Indian diabetics. So you can imagine how many, prevalence is even worse in Pakistan, Bangladesh, Sri Lanka, pathetic figures in whole Southeast Asia. When Ramadan is approaching, pre-Ramadan consultation, whenever it is slated, doctor should on his own or his counselor should raise this question. But one relevant change I have seen in the temperament in the people in the valley. Probably 2 decades back, people would just walk into the Ramadan, get into low blood sugars, get admitted into the emergency, and then seek a consultation. Not all, but at least 50-60% people. Even this morning, I saw people who how to handle Ramadan. We are going for Hajj, how to handle it, and this is a welcome change.
Okay.
I've seen it in the last 8-10 years. People walk into the clinic and walk into the consultation chamber and ask, we are going for Hajj,
do you
we're
agree,
going for
Dr.
Ramadan.
Iqbal, that people are getting sensitive, like health-related issues?
Of course. And I would say ladies much more than gents. Because when I go on my morning walk, I see most of the ladies doing their morning round. And people do especially understand these problems, that they need to look for their doctor, especially in Ramadan, before they undertake a fast. Many physicians have been telling me in the last few days that people have been coming to their clinics and seeking advice. They want to fast, but at the same time they want to take care of their health, which is the right attitude.
I wanted to ask you that there are many students who are having their examination, but the students are complaining headaches because of they lack concentration when they're reading and when they're studying, and they're complaining that blood pressure fluctuations just because of the nutrient level and the fluid level in the body. I mean, what should they do to have a better concentration? What should they do to enhance this concentration?
I simply cannot see any connection between a hard study and keeping a fast.
Okay.
Absolutely nil. They can take the fast and study at the same time.
Okay.
If they are more absorbed in the studies, the time will fly. It will make them meal better, rather than a person who is doing nothing and waiting for his iftar.
Exactly. So is it good for a pregnant woman to observe fast?
Well, as a matter of rule, no. But some Muslim scientists, I've heard some papers, I've read some papers recently, they say in early pregnancy it might be possible to give, but as the pregnancy advances, then it's definitely not advisable.
Do you agree with that?
Yes, so what I would say is most of the times we do see patients, who are pregnant, who have either a thyroid disease or diabetes. Thyroid problem is invariably, if the patient is stable, subtle, no previous problems with the pregnancies, we do let them go through it and watch them. But with diabetes, I'm a bit circumspect and I'm a bit skeptical. So because blood sugars can fluctuate quite a bit, particularly who are on multiple drugs or on insulin, and quite a few of those women do happen to be on insulin in the later part of the pregnancy. So I am a bit hesitant in that part, and I think that is warranted because at the end of the day,
Yes.
We have to see that this lady not only remains well, but the fetus is not damaged.
Even it has a provision in Islam as well.
No, absolutely. There's no doubt in that. So that's what I'm saying, that there are some hesitations in letting the pregnant women go through.
This question is for both the doctors, that we see that there's a rise in certain diseases in Kashmir when it comes to malignancy, or there are diseases like diabetes, blood pressure related issues. Is it that we have bad food habits, or we don't know what to eat and what not to eat?
I'll tell you a fascinating figure that I didn't know until last month, because I had to talk on bariatric surgery, so I dig up some data. It was a satellite talk telecasted throughout the country from Ahmedabad. It was on bariatric surgery, and I was amazed at looking at some data from United States.
Okay.
I'm aware as a clinician, as a doctor, as a professional, that how much awareness in the Western world has been about obesity, heart disease in the last 30-40 years, because I have been in the middle of it, thick of it, as a clinician, as a researcher. But this piece of information, dearish, was unbelievable even for me. There has been a steady increase in obesity in United States. They have a mechanism of surveying their nations. We call them enhanced studies, the national, sort of keeping a watch on health. There has been a steady increase in the obesity in United States from 60s till 2000. And by the middle of 80s, there was already sufficient noise in the Western world about heart disease, about diabetes, about obesity. It has almost doubled up in spite of that awareness from 2000 to 2010. So what does it mean? What is attributable to? Increase in weight, a lifestyle change. Mankind has almost utterly failed in containing it. And where US was 30, 40 years back, when it took off with those non-communicable diseases, we have touched the tail a decade back. We are well advanced on that curve. And if public is not made aware of it, if doctors don't take cognizance of it, we did our first study about more than a decade back, found out that 8% of Kashmiris have diabetes and 27% have pre-diabetes. We published only a few years back a study in younger individuals where we were aghast. Between 20 and 40 years, 1/4 of our youngsters have pre-diabetes. And this is what is happening.
But why is it so, Dr. Iqbal? Why is it so? Why are we lagging behind in having concerns about the health?
Change in lifestyle. You see, when we were youngsters, our diet used to contain, on our breakfast, there was no almond butter. Now you have a cake in every house, you see, and loads of it. And so, you see, some years back, some decades back, cholecystitis, which is the infection, or the gallstones, stones in the gallbladder, that used to be said that it alludes to 5 Fs, that is female, fat, 40, fair, fertile. But now we are seeing more and more evidence of cases in their early 20s or even late teens who are getting gallstones.
Yes.
So our diet has undergone a lot of change, and physical activity that we used to walk a lot in the past. I mean, it was necessity. We had to go from one place to another place. Walking means of transport were not available.
The way we are looking at Ramadan, there are people who are on injections or on drugs, especially those who are on injections and patches, painkillers. I mean, if they go to ulamas, they say, one ulama says that you cannot go for an injection while you're fasting. Other ulama says you can. I just want to know the medical perspective, that you must have been reading that. Is it good to get injections done while you're fasting? Is it prevalent that can we do that?
Medical science concurs with religious ulamas that injections cannot be taken. While as inhalers are concerned, some say it can be used. Some say, for example, a case of bronchial asthma. Right. But injections are out. They cannot be taken. You cannot take anything orally, tablets, etc.
And how about those who are on dialysis? And
I'll make a point here. This is absolutely important. We discussed when I said that we had conducted that global meeting on Ramadan, diabetes in particular, and touched on other issues also. we raised an important issue of hypoglycemia and can we do a blood sugar. Most of the ulamas concurred taking a blood sample is giving, not taking. So, they said it does not break the fast.
Okay.
So, it's not like giving an injection, so that, because it's a prickness, so I needed a bit of a clarification.
Okay.
People should not take that also as interpretation, because I routinely ask people whom I ask to fast or otherwise stable. So late in the afternoon, do a blood sugar after a few days, so that, I'm comfortable at 4 or 5, the blood sugars are respected, they're not sinking into low levels, and by the time they walk into, if they are in, they get into.
So how about blood transfusions and dialysis?
No, that amounts to the same thing. Blood transfusion, dialysis, that amounts to whatever is relevant for injections. And I think otherwise also a person who is on dialysis, I do not think, as very aptly and nicely put in by my colleague, there is a provision there. Why to overdo it? So leave it to the concerned doctor.
Right.
Let him make the decision. And dialysis is a serious issue, a life-threatening issue. So some things need to be left to the decision of the doctor who is treating that. That's why I said decisions need to be customized to the individuals and to the sicknesses.
Besides these diseases, there is a one bigger disease that many men in Kashmir have, is that smoking. How do you think that Ramadan can help people quit smoking?
Oh my gosh, wouldn't I be delighted?
No, I'm talking about those men who are like habitual of smoking, and can they quit? Can Ramadan help actually person quit smoking?
Some people they reported that they tried in Ramadan and got away with it.
You will always say when a smoker, fasts, the first thing he does after sipping some water or whatever, taking some dates, the first thing will be taking a fag around the corner. But it will be a huge beneficial thing if people can, stick to it. And WHO issues their own data every year, how people die on this globe, World Health Organization. In 2005-06, they release their data in New Delhi. They do it in different continents every year, being a global representative. And they said the previous year 5 crore people had died of non-communicable diseases the world over. He said if people had just taken aspirin and stopped smoking, 1.5 crore would have been alive. So you can imagine what benefits accrue by not smoking. So
And do you agree that Ramadan has a benefit on these smokers and those who are into such habits?
Absolutely.
And what are the general do's and don'ts for a common human body with or without a disease in Ramadan, so that at least they have a nice fasting?
Let's talk of summer Ramadan now.
Yes.
You see, if we say the word Ramadan, the root word is Ramida or Ar-Ramada in Arabic. You see, it means scorching heat or extreme dryness.
Right.
Once you talk of Ar-Ramida or Ar-Ramada, scorching heat, that scorching heat we don't have in Kashmir. Our climate is salubrious, it's moderate all the time. Especially in summers, our summers are quite salubrious.
But the day is too long. It's like about 16-hour day. So what should a person do to sustain for 16 hours?
Well, you see, you can take fast not only for 16 hours, you can take it for 3 to 4 days.
Okay.
We do have reserves in our body, which keep us living. For example, with any excess food is stored in our liver. And we can, energy-wise, we can sustain. I mean, there's absolutely no danger of, ending your life if you keep a fast. There's absolutely nothing like that. It's a matter of tolerance. And moreover, there's a religious angle. You see, we are not looked at it. A spiritual angle, a moral angle, and a societal angle also. It's Ramadan which makes us aware of those segments of our society who face deprivation, who want to eat but they have no food, and we have to experience that hunger to know their plight. There's a moral angle involved in it, and as I told you, it's a month of spiritual consciousness, and it's a month of moral consciousness also, and of societal concern also.
Dr. Zargar, I'll take from you the last note, that what do you think are the do's and don'ts for the month of Ramadan, and how can people actually survive a 16-hour long fast?
You'll be amazed to know that most of the information, whatever is scientific data collected and based, you'll be amazed to know more than 60% of the individuals consume more calories during Ramadan than in non-Ramadan period. If you see our lifestyle during Ramadan, the way we eat at iftar. You see, we are so hungry, and then we take dinner also, and then we take a huge sahri also because we feel quite insecure.
Right.
And the first lesson is, as very aptly again said, moderation in that also. Take a little bit of, this thing at the time of iftar, and then have a dinner. There's conventional dinner. You don't have to overdo it. There's nothing like, you already have stores in the body, you have fat in the body, you have other caloric source in the body. You don't have to overdo it. Take a dinner that you otherwise take normally. Don't overdo it. Particularly those who are sick and some of those things which they are not supposed to eat, they're overdoing it during that period.
Okay.
So conventional, high caloric stuff that we eat during that. Everybody taking meat, will not have proper appetite,
Right.
ristas and gushtabas, halwas and all, so those things, just behave in a normal fashion. Probably eating at iftar time a normal dinner, taking immediately some fluids, very relevant because the body is deprived of some fluids.
Right.
But more importantly, at the time of sahri, don't do enough of fluids.
Okay.
Those foods that get slowly absorbed over a period of time.
Okay.
Maybe you do some course for a good part of the day, but in the later part of the evening, you don't overdo things, particularly individuals who are on multiple drugs and particularly who are not well, and elderly people.
Okay.
After 4 o'clock, just taking it a bit calmly and coolly, most of the people should be doing pretty well. If these few things, eat comfortably in the evening, don't overdo it at sahri, take enough of fluids, spend a normal working day, late in the evenings, don't overdo things, particularly individuals who are 60 or above.
Yeah, exactly.
Things should happen
Last year,
perfectly.
what most of the hospitals complained, especially at the iftar time, that there have been patients who've been coming with a complaint that they've overdone, they've overeaten, and then they have vomited or they have had issues after eating so much. So that is why this program was called, so that people will have at least an understanding that it is all to do with the nutrients and fluid. It's not to do with the amount of food that they eat, and especially those who are sick and are not healthy. That is why we call this esteemed jury, to at least know that the people think this way and you have answers for them the other way. And from you we got to know that it is really important for those who are suffering from diseases that they should at least see a doctor before entering into the month of Ramadan. Even otherwise, people who want to see the doctor, so that to know that what can be done to sustain the long hours and what foods are good. That is why this debate was called. Thank you so much for at least sharing with us that what is good for a normal and abnormal human body. Thanks a lot for joining us on Rising Kashmir Debates. Actually, month of Ramadan has a lot to do with the body. We usually say that it changes the mechanism of the body, and as rightly said by Dr. Javid Iqbal, that yes, it definitely has something to do with the human body, but then it has something really to do with the spiritual angle of human mind, and which is very important for a human being to understand that we should not take fast as something which is a burden, and we should not keep it on heart as a fear. We should go with it with all the good feeling and with all the spirituality in mind. Thanks for watching this episode of Rising Kashmir Debates, and we hope that this will bring at least a slightest of idea that how much health is important during the month of Ramadan. Thank you so much for watching this edition. See you next time. Till then, bye-bye.